Buenas tardes con ustedes todo. Bienvenidos con el Diaton Press Briefing para este día, Mayo 1, 2020. Quiere kita informa con el Diaton mga kompoblanos que base na informasyon que relata el Diaton Presidential Spokesman, Secretary Harry Roque, con el Diaton Alcalde del Ciudad, el Diaton Pidimiento para esta bajo na State of Enhanced Community Quarantine y aprobaya el Interagency Task Force on COVID-19. Este tarde ay manhunto ka naton el Diaton City Health Officer, Dr. Dulce Miravite, el portavoz del Zamboanga City Medical Center, Dr. Justin Paber, y también el Diaton City Jail Warden del Zamboanga City Reformatory Center, si Jail Chief Inspector Nathaniel Alhas. Tiene kita mga signifikante mejoras kaya implementa amoganese el Diaton increased capacity for testing because of our contract that we entered into together with St. Luke's. Por eso este mga tiempo, mas pronto ya talaga el mga resulta del Diaton mga pasyente. Y ahora ay uwi kita con el oficial de salud del ciudad, Doktora Dulce Miravite.
Good afternoon. As of today, we have a total of 463 suspected cases, an additional of 132 cases for the last 2 days. We have no probable case. So we have 11 confirmed positive cases for Zamboanga City, 2 are in NCR, 9 are in the city. Out of the 9, 3 are admitted, 4 have been discharged. So the recent discharge today is patient ZZ08. And we have 2 mortality. A total of 391 specimens were sent for testing. 192 are already with negative results, and 190 are still pending. We have already sent 123 specimens to St. Luke's Medical Center. This is an initiative of the local government facilitated by Brent Hospital. 119 of these samples are from the close contact at the City Reformatory Center. In the last 2 days, we have received a total of 51 results. Out of these results are the 2 positive, the ones that we have ZC10 and ZC11, and the rest are negative. So we have 32 patients admitted at the Adzu Lantaka Isolation Facility. The facility is also used as a step-down facility for stable patients transferred from ZCMC for completion of the required quarantine days. Our total COVID-related deaths is at 67, 10 new cases from the last 2 days. So 25 of these have already negative results and 12 pending results. So with the additional of the 123 specimen that we have sent for testing at St. Luke's, we are expecting for a possible increase of our cases in the coming days.
Okay, so to begin with the questions, we have questions from Cecil Aboy. There is a Zamboangueña question from a Zamboangueña stranded in Manila. Is it true that upon arrival of all travelers from Manila, they will proceed directly to a quarantine facility to undergo the 14-day quarantine period?
Yes, all those who will be returning to Zamboanga City will be subjected to our medical screening process. So we will require at least a medical certificate from their end, and they will be also quarantined. If needed, we will do the rapid antibody testing to them, and if they are symptomatic, then we will also do swabbing.
Okay. Another question. What is the status of el Diaton 20-year-old Nuevo Parida que Yamuri, EL 16-year-old that they were swabbed?
So these 2 have been tagged as COVID-related deaths. So they have been swabbed, and we are still waiting for their results.
And Berdad ba kay Chene Yamuri Unmuher? I think this question is directed to our city jail warden, Jail Chief Inspector Nathaniel Alhas, sir. The question is, Chene ba Unmuher person deprived of liberty kay Yamuri na Zamboanga City Reformatory Center?
Sir, as far as I heard, no, although I'm not in authority because this is a separate ward, no, I am the warden of Zamboanga City Male Dormitory, and the other one is the female dorm. They have another jail warden assigned there at. But what I heard, no, what I heard, confirmed they have one female who expired yesterday.
Okay.
So I would like to
Yes,
add on that. Yes, apparently this is a COVID-related death. She's a 62-year-old with underlying condition. She's diabetic. She's a known diabetic. And basically, the diagnosis is community-acquired pneumonia, diabetes type 2 uncontrolled, and hyperosmolar hyperglycemic state. So, the patient has been swabbed pending results.
in relation to that question for our city jail warden, sir, do you have a data on the total number of persons deprived of liberty who are admitted currently at the Zamboanga City Medical Center who are considered as suspected cases of COVID?
Yes, we have only one, the case number 10 we have, and also we have patient at the other private hospital. So for the record, we have only two PDL confined in separate two hospitals.
Follow-up question to you, sir. How many persons deprived of liberty or under your care have revealed symptoms of COVID-19? And how many
I,
were swabbed by the medical team of the City Health?
I'm referring to the 91. At present, we have 91 PDL who have undergone swab testing. For the record, for the past 2 days monitored by our frontliners jail nurse, they have manifested normal body temperature, meaning nag-improve po yung body temperature nila compared sa previous days na may mga mataas konti na slight lagnat. Ngayon wala pong lagnat. Relatively normal po sila. So we have 91 PDL na swab. We have also 34 for request pending for swabbing operation, no, to coordination with CHO and the Office of the City Mayor na chinikita karta ya liba iste ng request kita for causa LD aton patient 10 was confined in our infirmary for almost 3 months. 3 months kasi yan kumitle 22 January 2020 noy lale man confine na di aton general cells diretso le na infirmary. So el contact gayet alya to alya lang gayet konsentra na infirmary. So we have 31 patients confined di aton infirmary, then plus 3, so all in all 34. We requested that for swabbing test.
Thank you very much, Chief Inspector. Now we have a question from Cy Cortez to our City Health Officer. Ketalya, si patient ZZ02, it's been a month since siya kedale positive. Nuay pa ba siyempre kunele man discharge?
Our patient ZZ03 is still admitted at Zamboanga City Medical Center. Actually, her second swab is still positive. That's why she was swabbed 2 days ago. So we are still awaiting for the result of that swab. But she's stable and we are waiting for her results to be out. Then, if negative, pwede kita ko man discharge.
Okay. So now we have series of questions addressed to Dr. Justin Paber, the spokesman of the CCMC. Dr. Justin, from Cecil Aboy, the question is, Chenia ba kita mga frontliners del CCMC kaya man give up na COVID?
So far, our frontliners are still monitored. They're all still healthy. We still do not have frontliners who are tested as mga moderate or severe PUIs. So thank God they're still all healthy ara. Wahala, it can remain that way.
Okay. And then the next question is, ta-accepta pa ba kita pasyente na di aton CCMC other than COVID-related patients?
Up to now, we still follow the mandate of the Zamboanga City Medical Center, which is to accept both COVID-related cases as well as non-COVID-related cases. So we still accept non-COVID-related cases that are needed for tertiary care in Zamboanga City Medical Center.
Another question from RG Go, Doc Justin. How many groups are rotating in our COVID center? How is their health? Do we have suspected or probable cases?
So right now, we had initial two healthcare workers, mild symptoms already recovered right now. Total of our healthcare workers in quarantine right now is almost 121.
Okay, thank you. We have a question from Ms. RG Go to our City Health Officer. With respect to patient ZZ09, have you been able to establish the possible cause or the carrier of the virus inside the premises of our Zamboanga City Reformatory Center?
So, the possible carriers of this are the visitors or even the personnel who have history of travel even before the lockdown. We are still looking at other sources, but basically these are the two possibilities that we are entertaining. Because although we have placed, I know that our jail chief, jail warden already has in place the team loob and team labas, no, the lockdown in the jail. But even before that, visitors are still going in, so they are the possible sources of this infection.
Okay. So in relation to that question, Doc Dulce, still from RG Go, the question is, what are the measures that are being implemented in the city jail in order to lessen the infection of COVID-19 among our inmates?
So,
Okay,
Okay, maybe
Okay.
our city jail warden can answer that.
thank you very much, Attorney Kenneth Bilduwa, sir. With respect to the City Health Officer Condolta, Dr. Dulce Mirabiti, ma'am, actually, by guidance by the City Health Office, when they came over, they have inspected, in fact, our two isolated cell. Kinonvert natin yung cell 15 and cell 20. We covered it up through plastic cellophane, naka-bandage siya, although may slide for ventilation purposes. And then, of course, nag-establish tayo distribute tayo ng face mask, tapos emphasize natin yung personal hygiene nila, na kung mag-cough sila sa kapag sneeze. We conducted misting. In fact, paubos ng supply, 3 times a day kami nagkakandak ng misting. Although hindi ma-emphasize yung social distancing sa loob ng selda, considering of the congestion rate, we encourage them somehow to drink more water, wash regularly their hands, and of course, ni-restrict natin ang other PDLs to get near to that isolated cells.
Okay, sir. So that question was also asked by Miss Julie Alipala. Now it
And
was
so far,
yes.
so good naman, as I have mentioned a while ago, for 2 days, relatively normal na po yung body temperature, meaning wala na po silang lagnat.
Okay, sir. So
In addition, binibigyan natin sila ng daily medicine vitamins na binibigay sa atin sa mga support, even the City Government of Zamboanga. And nagbibigay tayo additional na daily banana for potassium intake nila, no? Sustenance, nagbibigay tayo.
sir, in relation to that question, there is a follow-up question from Miss Julie Alipala. Do you have any plans to put up an isolation and treatment facility inside the premises of the Reformatory Center?
In respect to that, actually, in place na po yung plan per guidance po ng City Health when they came over. We have established and asked for, of course, we have now erected 4 mobile tent, 2 from DOH, a bigger one, and 2 from the City Health Office. We have temporarily constructed 3 comfort rooms with 2 lavatories. We have made a cut bed, wooden type, 25 pieces. If in case there will be, as mentioned, moderate, mild PDL found positive, possible quarantine area will be the basketball court. So we will also put up a barrier made of cellophane plastic to give restriction to other PDL to cross over.
Okay. Sir, just as a matter of reiteration, we have a question from Teodiver Arquisa with respect to the status of the patients who are in the infirmatory of the city jail. Will you please elaborate it again, sir?
Generally, our jail nurse, although there are only two, we augmented temporarily additional two from the STAR team, our emergency response team detailed inside. Uh, Namomonitor naman sila, wala naman pong seriousness na signs. In fact, andun yung kasama natin na nasa loob. Wala naman pong sinasabing na severe yung mga condition nila. Relatively manageable naman po sa ating mga jail nurse. Should there be any cases na mag-shoot up ang kanilang condition, meaning to say needs further medical treatment sa hospital, then we will coordinate the CHO and the CCMC for that matter.
Okay. So, thank you very much, Chief Inspector. We now have a question. I think this is for Doc Dulce with respect to the status of the female inmate. Because, again, as the jail Chief Inspector mentioned, this inmate is in another dormitory. So, I think our City Health Officer can discuss ang mga detalye de este female inmate kaya muri.
So yesterday, this female PDL, 62-year-old, was rushed to Mindanao Central Sanitarium because of an hyperglycemic episode. Known diabetic este PDL, soya subi LDC blood sugar, soya andas liba gane na MCS. So this patient was swabbed and pending results and expired at the same hospital. So the final diagnosis is community-acquired pneumonia, diabetes mellitus type 2 uncontrolled, and hyperosmolar hyperglycemic state. So to consider COVID-19 patient. So suspected COVID death este.
Okay. Another question for Doc Dulce. What is the status of patient number 8? Kaya man recover ya?
Yes, so patient number 8 has been swabbed already with repeat negative results. So that's why he was discharged today. But we're going to monitor him until 14 days. We will have to swab again.
And another question for our City Health Officer. ¿Por qué corre el salida del resulta ahora?
Really, este mga tadali kita, no? Este liga gane within the last 2 days are from Davao, so SPMC este ase. But we have other one result yesterday that was from RITM. So Siyempre yensen kita mga specimen, CL testing capacity del laboratory onde kita konele yensen is mucho ta pwede sila man run el test mucho. So pas tamen ta pwede liga el result akika naton.
Okay. We have a follow-up question from Ms. Julie Alipala. May we reiterate again the breakdown of our data, Doc? And she's also asking how many children died or are categorized as suspected COVID patients. And she is mentioning also a patient from Basilan. Do you know the particular town from which where the patient came from?
Okay, so again, we have a total of 463 suspected cases as of today. 11 confirmed, 2 in NCR, 9 in Zamboanga City. 3 are admitted, 4 have been discharged. The recent discharge is CZ08 with 2 mortality. So our total specimen sent is 391, 192 with negative results, and 190 with pending results. So for the child, we have from 0 to 9 years old, we have 7 aki LD aton chene kita 7 pasyente with COVID related suspected deaths that are children ages 0 to 9 years old. El akal na Basilan, we do not know exactly LD Suyu address because el kosa kita channel na di aton database is only Basilan, no? But maybe we can ask Zamboanga City Medical Center for more details about this.
Okay. Can our good doctor Justin Paber provide the details?
For the Basilan patient, we have one patient, also the data from Basilan. This patient died through hypoxic ischemic encephalopathy, secondary. So it's HIE secondary to still pneumonia. The consideration is a CNS infection.
Okay. So, Doc Justin, there is a question here in terms of planning on the quarantine facilities. Do you have additional facilities now with respect to quarantine facilities Alina de Ustedes Hospital?
As far as quarantine facilities, the Zamboanga City Medical Center is responsible for treatment of actual patients who have moderate, severe COVID-related symptoms as well as the COVID-positive patients. Quarantine facilities is presently responsibility of our LGU in setting up, as Dr. Dulce mentioned, we already have a step-down facility in Lantaka. Hopefully, we can activate other quarantine facilities in the city.
Okay, Doc, for our we have a question, Doc Justin. Zamboanga City has the most advanced medical facilities compared to other nearby cities and provinces. Are we still open to the possibility of accepting COVID-19 patients if the circumstances so warrant?
So the mandate of the Zamboanga City Medical Center is we're the apex hospital for the region. So if patients will come to Zamboanga City Medical Center, it enters our gates, we'll be responsible in accepting the COVID-related patients wherever they may come from in our region.
Okay, there's another question, Doc Justin, from Chodiver. Kosakal taabla si Mayor Subi El case na May 8 to 11. Why?
If we follow the trajectory of the presented epidemiological data, presently we still follow that there's still expected rise of cases. Right now, we have pending, as Dr. Dulce mentioned, quite a number of pending cases. So as soon as the results come out from these cases, we'll have a better idea of the actual increase in the number of our COVID patients.
Okay, thank you, Doc Justin. For our Jail Chief Inspector, Nathaniel Alhas, sir, can the BJMP clarify the extent of the contact of patient number 10? Like when he showed the initial signs of heart failure at the infirmary, is it true that his family was called to watch him for 24 hours? This is a question from Jewel Reyes.
I would like to emphasize to the public that when patient number COVID-10 was admitted or committed to Zamboanga City Jail last 22 January, he was not detained at ordinary cells but rather direct to our infirmary because of his heart-related disease based on the attached medication. So we did not anymore remove him from then doon sa infirmary. Doon na siya hanggang sa na-confine na siya sa hospital na labas noong April 26. Then ngayon, presently, nasa Zamboanga Medical Center. So the containment will be focused only on the infirmary section of our jail facility.
Okay.
Kasi doon lang siya po naka-confine.
Salamat, sir. Meron po tayong katanungan from Theodiver. Yung mga na-release na persons deprived of liberty, meron po bang na-report sa inyo na nagkalagnat yung iba?
So far, we gave all the information during the initial briefing meeting with CHO at saka DOH, the names, cell phone number, and the addresses. Then they told us they'll be the one to follow it up sa residence nila. Together also, the following day, nag-coordinate din yung NICA natin to do the contact tracing. So far, we have not done any monitoring of their health condition in their respective residence.
So I would just like to add, yes, thank you, Sir Alhas. We are monitoring all the freed PDL in the community, and so far all of them are asymptomatic, so they are well, and they are being monitored daily.
Okay. Thank you very much, Doctora. There's a question from Mr. Bob Haldon to our City Health Officer. Clearly, the path to control the surge of the virus is through testing. What is your office doing to acquire the testing kits? Having done that, who are the testing targets? Do we have a specific class like the rich, the poor, or the middle class?
So through our MOA with Brent Hospital, we have requested for more testing kits to come so that we will be able to test the vulnerable population. So, who are we going to test? Doesn't matter if they're rich, poor, or the middle class, as long as they are the vulnerable population, which are symptomatic or our suspected COVID cases. So, we plan to get them all tested, our suspected COVID patients, and especially the close contact also of our confirmed cases. And we would also plan to test, get a sampling, a random sampling of the high-risk barangays or population, especially in barangays with very people who are living in congested places. So these are our plans, and we are waiting for more test kits to be sent to us by St. Luke so that we will be able to test.
Okay. In relation to that question, Doctora, there's a question here. 40 days had passed. Where are the test kits? Why did we not think of sending samples to Davao City instead of Manila? Because he or she thinks that the results from Davao came out faster.
Okay. So the testing kits initially, St. Luke sent us 200 testing kits, and we have utilized 123 of these already, and we have sent the samples already to St. Luke's. So initially, all the testing is done in the RITM, in our national laboratory. And when the Philippines had a number of testing kits already, so the satellite laboratories have been given these kits for them to be able to do the test. So one of the satellite laboratories is the SPMC in Davao City. So ara tsenaya kita tres bilog, no, but onde kita pwede libael di atun specimen. So in the RITM, in Davao, and in St. Luke's. So that's why if we chichene gani kita el di aton own laboratory aki, so mas mucho kita tests pwede ase.
Thank you, Doc. We have a question from Miss Shirley Espino. How many patients, Doc Dulce, are now occupying the Lantaka campus? How many are to be quarantined in other facilities like the one in Ecozone? And what is the status of our frontliners? Do we have enough health workers assigned in these areas?
So as of today, we have 32 admitted at Lantaka, but we still have additional admissions coming in. So our patients are already increasing in Lantaka. We are preparing our isolation facility in Ecozone. We are preparing for 2 facilities there, which can accommodate 68 patients per isolation facility. Then our manpower at this point is enough, but if we're going to increase our patients, then we will have to add our manpower, and we have asked the budget officer to give us more job orders so that we will be able to fill in these positions for manpower to be available to man this isolation facility.
Okay. Doc Dulce from Sai Cortez, tiene ba daw resulta yalega i medyo hindi bueno el resulta kaya yalega kung nadiaton mga pasyente?
So we have sent our specimen, 49 specimen last Monday at St. Luke. So anytime today or tomorrow, we are expecting for the results, Sir Sai.
Okay. From Jewel Reyes, all suspect cases that were they swabbed only once, and once the negative result immediately released, or are they required to be reswabbed? What is their protocol before they are released or discharged?
So for our suspected cases, once their first result is negative, they just have to complete their 14 days quarantine so that they will be able to be discharged.
Okay. Sir, to our jail chief inspector Alhas, sir, we have a question from Miss Julie Alipala. Pwede po bang malaman ulit yung figures, how many inmates po kayo meron and how many jail personnel? Gaano kalaki ang espasyo sa loob ng inyong facility?
At present, we have 3,319 because of the one being dismissed. We have 128 human resource, but sad to note, some of which have undergone quarantine, yung 13 na swab test. All in all na swab test personnel are 20. 20. Sa dimension naman area ng ating jail, hindi po sobrang kalakihan. As mentioned nga, umabot tayo ng 1,000 more than percent congestion rate. So more or less, ano lang to ng mga 600 plus 600 plus square meter, almost more than half lang ng isang hektarya.
Okay. So, sir, in relation to that, we have another question from Cecil Abuy. Do we have separate wards for inmates who are manifesting symptoms? Are they
Yes, we
being
have already
segregated?
separated them. Doon sa 3 additional queues improvise natin, naka-seal po siya ng plastic cellophane. Isa na rin doon po yung galing na sa hospital na gumaling. Nag-undergo siya ng quarantine doon for 10 days na po, and he is getting well.
We have a question for Dr. Dulce from Teodiver. Kosa-kosa barangay, aki, tiene mucho gat numero de mag-aapektaw no, na COVID. Aki na diaton syudad, Doc.
So, si abda to COVID-related deaths, Chenegan kita, no? Baliwasan with 5, Tetuan 3, Mercedes 3, Talon-Talon 3, Kulyanan 3, Paso Nangka 3, Patalon 3. So, amo siya mga barangay with the most number of deaths that we have that are suspected. And now, from BJMP, we have recorded 3 PDL deaths also. So, amo kalail mga top barangays.
Doc, in relation to our ongoing efforts with respect na diaton testing, siya ni question, porque mucho gayod mga Yamuri PUIs no ipakonfirma, is it because the testing has taken too long and are no longer viable?
So, este mga pasyente taanda na di aton hospital at siya na sila mga simptomas that could lead to siya na sila mga sintomas that COVID-like na pwede man manifest as COVID. So, they are tagged as a suspected COVID case. And it just so happen na taanda sila, they are already manifesting severe symptoms. So, even before the results are in, taliga ka naton el results, ya pwede kita kanila man swab, yamurya sila. That's why takedangan di aton suspected deaths.
Siya niya ba kita update, Doc, kung akal gani mga anak del di aton pasyente, akal patient, akal 94-year-old patient?
Yes, actually negative LDCU result.
Okay. So before we go back to our city health officer, we will just answer some of the questions. We have a question from Jewel Reyes. Please tell us about the LGU plan to buy a PCR machine through the supplemental budget as relayed by the Vice Mayor, Attorney Romel Agan. This is true. I conferred with the City Budget Officer and we have received information that in our supplemental budget number 2, which will be taken up during our regular session on Tuesday in the City Council, there will be a provision of 10 million pesos for the purchase of 2 PCR machines. So, tiyan kita fondo ya aloka, 10 million para compra 2 PCR machines kaya asigun no el di ila estimated value tali na 5 million el un machine. And then we have a question si yaman GCQ ya ba kita, this is from Sai Cortez. Si yaman GCQ ya ba kita el di aton QP keda baste useless. Cuánto gali kita ya gasta para na printing del di aton QP? This question as to the cost of our quarantine passes was also asked by Miss Julie Alipala. So este diato na quarantine pass maskin gani na GCQ tausa syempre sa kita. Kaya ta esta syempre reglamento del GCQ que el magabibientes pwede lang sila sali na dila magakasa para kompra maga cosas importante ianda na maga establecimiento que pwede ya abre. Pero as gani kita klaro no como ya dali kita anunsyo na diaton opening que as este maga tiempo ya aprobaya el diaton IATF on COVID el pedimiento del ciudad para esta bajo na ECQ. So este pregunta acerca el printing del diaton quarantine passes. Kaya kita manda sabi kaya man print el gobierno lokal total de 248,500 quarantine passes at the cost of 3 pesos and 50 centavos each. El yaman print con este el Freedom Commercial Printers iya sige kita con el required procurement process. And then the next question is, are there financial benefits or any form of benefits that families of COVID-19 patients can expect? Are hospital bills of confirmed COVID patients given for free? Or is it sponsored by the LGU? So, diaton kontestasyon, si diaton magapasyente, tali sila na diaton Lantaka Isolation Facility or admitido na diaton Zamboanga City Medical Center, nuay sila ko sa ay gasta ali. El beneficio, ta pwede kita dali ayuda por medio del asistensya kita dali al gobyerno lokal. And then, question also, there are government offices and private companies now requiring the employees to work on a modified number due to the NCR GCQ order. So, even in a general community quarantine, kaya kita informa, kay tiyan sa mga reglamento, hindi sa basta-basta lang pwede sila reporta. Pero como syempre, testa kita na ECQ, so we will maintain status quo. Another question from Jewel Reyes, are there tax relief being issued by the LGU to local businesses? Kaya kita sa akorda, kaya dal maga-resyente sesyon kaya ya pasal diatong konseho lokal maga tax relief ordinances. Amo nga ni kala diato na tax relief on not really a relief but an extension for the payment of taxes, no? Yaman extend kita el periodo donde paga el magabuwis como agal diaton real property tax, diaton business tax, y también el amusement tax. No pwede kita dali complete relief kay este magabuwis kita paga na gobyerno lokal, ali también kita tasakal fondo para man-respond kung este diaton krisis, para man-hire mas mucho pa mga nurses, y también compra el necesita comida para dali na diaton mga vivientes. And next question we have for our city jail warden, Sir Alhas. When patient ZZ10 stayed inside the city jail infirmary, was he visited by any relative after the March 20 lockdown?
Wala na pong dalaw noong March 14 pa lang. Wala na pong dalaw. So, before nung wala nang dalaw, meron siyang regular visitor po. Binibisita siya po sa infirmary ng relative.
Before yung lockdown. So it's very clear that before the lockdown, he had received regular visitors, but after the lockdown, no one was allowed to enter.
Correction lang sir, nung 14 March, wala na pong dalaw inaalaw. Nag-lockdown po kami 20 March. So ahead po sa lockdown, wala nang dalaw.
Thank you very much. Thank you very much, Chief Inspector. We have a question. I think this can be answered by Dr. Justin Paber. Doc, in Zamboanga City Medical Center, was patient ZZ10 visited or watched by inside the emergency room during his admission?
All patients not COVID-related in Zamboanga City Medical Center, no watchers are allowed. So they are only exposed to our staff. All items that are needed to be brought to our watchers will be handled by our staff. So once you get inside the hospital, the policy is that no more watchers.
Doc, just another question, Doc Justin from LC Molina. Maybe you answered this earlier. Can we just reiterate? How are your health workers in the Zamboanga City Medical Center?
As far as today, we still have relatively healthy. Our workers are healthy. around 121 of them are in quarantine right now. Then they'll go. It's the fourth group already, so in quarantine. So hopefully by the time they finish their quarantine, they can already return back to their posts.
Thank you, Doc Justin. For Doc Dulce, from Santos Cortez, na 4 COVID patients yan discharge. Nuay ba aki dale mira ole sintomas? Continuous ba el monitoring kanila?
Kunil 4 discharge patients di aton, tan monitor kita kanila, and el di aton first patient yan discharge, yasa kagani kita ulit swab, so ta espera pa kita el di suyo resulta. El dos, we will be swabbing pa, and then man monitor kita ko na kal di aton ZCO8 na este dia lang yan discharge.
Okay. We have a follow-up question from Miss Julie. For Dr. Dulce, what are the chances of people inside the Zamboanga City Reformatory Center to be infected? This is based on the given space dimension by our city jail warden.
Yes, so the Reformatory Center is one of our high-risk area. Since we have a case here, it's the chances are high, very high, no, el di aton transmission aki na area di aton. So, yan swab gani kita el mga close contact and those who are manifesting symptoms. So, we are awaiting for their results. But given the vulnerability of the place gani, no, because they cannot practice el di aton physical distancing, so high risk el area di aton for the infection to be really contagious in this setting.
Okay. For Doc Justin from Bong Simbahon, if patients are subsidized inside the Zamboanga City Medical Center, can you investigate the case of that female PUI or suspected case? Quien ya escapa de mas temprano, aquella man retrieve na kalarian checkpoint. Kaya asigun, ya pa sa hambre el diaton na PUI adentro del diaton CCMC.
Sige sir, we can investigate on that some more, so we can
Okay.
give you the details later.
Thank you very much, Doc Justin. And some other questions from Roland Ramos na GCQ, yabla LDILG jeepneys, hindi pwede man biyahe, ko sa public transportation elman allow. Initially, cuando diskuti gani kita yaabla kita kay el mga taxi, pati el tricycle. Pero otra vez, quiere kita hace claro, kay este mga tiempo, efektibo este día hasta 15 días, taki kita syempre na ECQ. Okay, we have a question from Cecil Aboy to Jail Chief Inspector Alhas. Sir, if inmates who are PUIs and positive did not have any travel history, is there a possibility that one of your staff or personnel is a carrier?
As done in the contact tracing, the CA2 have considered them the very reason they included in the recommendation to be to undergo swab test. And in fact, I myself have volunteered, although aki lang yun na Region 9, no?
Okay, thank you very much, Jail Chief Inspector Alhas. We have a question from Miss Leti Militante. Are we ready both in terms of budget and health personnel if we reach the peak level of COVID-19 in our city? Maybe insofar as our health personnel, we can ask our city health officer to answer that, Doc.
So we have asked for more health personnel gani. So we are preparing if ever we will have a surge in our cases. And we are also looking at other organizations that can help us out with health personnel and doctors who can man our isolation facility.
Okay. So, akal na pregunta di Ma'am Leti Militante acerca el budget del gobierno local hasta este mga tiempo tiene nga ni kita suficiente fondo. Pero el question, hasta cuando este fondo di aton alcanza. Por eso, tapikuragat kita, no, man-minimize kung ang infeksyon na di aton mga bibientes, kay hindi kita siguraw si hasta cuando este krisis ke ta-enfrenta kita. And then we have a question from Ms. Tess Espartero. If yakabaya el 15 days extension, ya subi el numero del mga positive na COVID case ko sa el next move. No, di aton tamen akitamen na in relation to this question, yung pregunta si Miss Jewel Reyes, ECQ stay still May 15. After this, will the Sanggunian, the Task Force COVID, CDRRMO submit another resolution or retain dependent on the recommendation of the health experts? Kaya kita abla, kay este esfuerzo del diato na gobyerno nasyonal, donde gani taman extend every 15 days, kay tamira kita, the situation is very volatile. So we really depend on the recommendation of our health authorities, our doctors on the ground. Por eso ta esta syempre se depende si cosa sucede. Si subi el numero del mga kaso, itamira kita ben limitaw ya el mga fasilidad, el mga ospital aki na syudad, nisisita kita pidi kay man extend. Pero este mga tiempo, kaya dali ka naton extension de 15 días, ay obserba kita durante este tiempo, sinisita kita pidi otra vez another extension. We have a question from Bong Simbahon to Dr. Miravite. Have you already fixed the protocol problems we had earlier between the Zamboanga City Medical Center and the City Health Office in handling COVID patients to avoid conflicting reports or actions?
Yes, so actually yesterday we have sat down and we have come to terms on our protocols so that we will be in sync with our implementation of our COVID response. Maybe Dr. Justin can also say something because, yes.
Doc Justin?
We'd like also to thank our City Health Officer, Dr. Dulce, for attending our meeting yesterday. So some details as far as the protocols on handling of their COVID patients as well as handling of the dead were threshed out. We streamlined it so we can improve further on this protocol, sir.
Okay, Doc Justin, there's just a follow-up question from Theodiver. ¿Qué tal el mga otro pasyente na Zamboanga City Medical Center? Cosa el reglamento na bisitada ng mga non-COVID patients na mga watchers? Iakal na mga suspected COVID patients mga bata, allowed ba siya el mga nana?
So for the non-COVID patients, they have a different entrance, sir. So these are not, separated sila na entrance sa lahat ng mga COVID patients. So as much as possible to prevent cross-contamination between both different kinds of patients, different entrance, watchers are still allowed. For the pediatric patients, depends on the age and the clinical status of the patients. Watchers, so a single watcher is allowed per pediatric na COVID-related case.
Okay. So, thank you very much, Doc Justin. We will just answer some of the remaining questions. Why is it that not all were given relief for the SAP and the FFP? Este gane di aton na social amelioration program, kaya kita reitira, kaya este un programa del gobierno nacional kaya implementa el di aton DSWD. So, este numero del mga familia, ya pidi kita gane mas aumentaw numero, pero el man approve ka naton, limitaw lang. Por eso, hindi gayot se posible que puede recibir todos los familias aquí na diaton syudad. Acerca también del diaton family food packs, sabi kita, ben limitaw el diaton fondo at el tiempo gani sucede este rebentada del COVID-19 aquí na diaton syudad. Por eso, ya pikura kita, dale con aquellos quien necesita gayod. Pero como ya anunsya el diaton alcalde del mga días kaya pasa, el siguiente dalida del asistensya na mga familia, amo gani kalta consisti el diaton un saco arroz de 25 kilo y también mga delata y mga otro pa mga comestibles. Y también el ayuda para na pago de corriente y pago del agua na valor de 500 cada each, no, na diaton agua y también na diaton corriente. So amo se ay pasa el Consejo Local diato na Martes y si aproba kunese ay man-release siya con el ayuda para na diaton mga vivientes. And also, with respect to the monitoring del implementation del SAP, sabi kita mucho ng mga reported violations, mga reklamo, ese todo taman formulate kita el feedback na national government kay el gobyerno lokal, el diaton role ali, ya pidi lang sila kanaton ayuda no para paga kunese kay nuay gani sila gente on the ground. Pero el validation de ese, el proseso taase el diaton DSWD. So in the absence of further questions, I think we shall now hear the closing statements of our resource persons. Let's start with Dr. Justin Paber. Doc?
Thank you very much for this opportunity. So right now, we still ask the public to please follow the guidelines set forth by the government. Zamboanga City Medical Center is a treatment facility for the COVID-related cases in Zamboanga City. We'd like to work hand in hand with our city government, with the city health office, and also preparing step-down facilities as well as quarantine facilities so that this can help the hospital decongest. At the same time, it can still remain as a treatment facility that's needed in the city right now. So hopefully this cooperation with all the different agencies concerned, we can continue to do this, and then hopefully we can come out of this pandemic.
Thank you
Still
very
healthy.
much. Thank you very much, Doc Justin. We shall now listen to our City Jail Warden of the Zamboanga City Reformatory Center, Jail Chief Inspector Nathaniel Alhas. Sir.
Of course, would like to thank, of course, our beloved Mayor for the full support to our challenge we are facing right now, even to the Zamboanga City Medical Center, kung Dr. Justin Paber, kung Dr. Dulcine Rabite na City Health Office, of course, kung Attorney Kenneth. To our listening public, especially to the relatives of our PDL, the moment we conducted the lockdown, 24/7 work kitaki, we feelingly exhausted, but because of the cooperation of our PDL inside, we are in the high spirit to work for good. No worries po kasi ginagawa namin yung makakaya namin, makontain lang po itong problema to. Tulong-tulong na po ang hinihingi lang po namin, pangunawa at dasal sa inyo. Maraming salamat po.
Maraming salamat, Jail Chief Inspector Alhas. Dr. Dulce?
For now, our homes and our houses still remains to be our fortress where we are safe. So we tell sino ay manggat kita importante asa apuera saan ni kita nakasa. Ara pa lang kita tamira el mga kaso di aton and tasubiga ni el di aton mga suspected cases pa. And so we appeal to everyone to continue to practice LD aton wearing of mask, LD aton physical distancing, and LD aton regular hand washing and disinfection of our surroundings.
Thank you, Dr. Dulce. Otra vez, sa rindi kita gracias kung al diaton mga resource persons esta tarde, diaton na City Health Officer Dr. Dulce Miravite, al diaton na PIO del Zamboanga City Medical Center, Dr. Justin Paber, y también al diaton City Jail Warden si Jail Chief Inspector Nathaniel Alhas. Esta diaton na sitwasyon aquí na syudad de Zamboanga, ta esta syempre kita, baho na enhanced community quarantine. Quiere decir, el mga reglamento kaya impone kita, el mga leyes kaya pasa kita, tali siyempre ta implementa el diaton polisiya. Por eso, tapidi kita con el diaton mga vivientes, pabor hace mas largo el de ustedes pasensya, y dale el de ustedes cooperación para puede kita se acaba con este crisis na mas pronto tiempo. Muchas gracias y buenas tardes a todos.